Hi everybody, it's Dr. Nick here at Kalkstein Chiropractic. We're here with Elizabeth.
Yes.
Elizabeth recently made a trip to, was your dentist?
My orthodontist.
Orthodontist, because she has been grinding her teeth like a lot of us. And they recommended she get some work because all that grinding, all that tension she held is causing her a lot of discomfort in her jaw. So today we're gonna give her some good old TLC. Get her moving a little bit easier. I'm feeling better.
Yep.
So we're gonna start off with a little internal work. ART on the pterygoids here. It's not the most fun, but it's very beneficial. Right?
Yes.
Yeah. Alright. Open up and then close. Good. I'm gonna slide up right here. You close until you meet my finger. Good. Take it slow, open up as wide as you can. I'll start off a little soft for you that way. Close. You don't cry. I tear up when I get this too, so it's just a very sensitive spot. Go ahead and open. You okay with that pressure?
Mm-hmm.
Okay. Let's do two more right there. It's like the worst time to ask you a question. It's like when the dentist asks you like how your day was. They just tools in my mouth with a cotton swab and they got the suction going on. I'm like, I cannot answer you. Close. Go ahead and open. And then here before you know it, you're like drooling on yourself. It's just embarrassing. Good. Something close to you, meet my finger. Perfect. A little pressure. Go ahead and open. A little more sensitive on this side.
Mm-hmm.
Close. Right there. Go ahead and open. Good. So, besides the left side being the most painful side, what side do you feel like you have the most tension on?
This side.
The right side. So it's pretty common. Typically it's the opposite side. One side moves a lot, the other side kind of compensates, and the compensating side is most often the painful side. So what we're going to do next is I'm going to just hook onto the bottom of your molars here. It's going to be mobilization. I'm going to move your jaw around, and the most you have to do is try to relax. It's going to be weird because
Yep.
it's not something you're used to doing. So I'm going to hook right here, close lightly on my thumbs, and just try to keep your jaw relaxed here, okay? So I'm going to go side to side here, make a gentle figure 8, good. Try to relax that jaw. There it is, good. Good. And then relax it again. Let me come up and then down. How'd that feel?
Good.
Weird?
Yeah. It's hard to relax your jaw.
It really is. It really is. So, did some internal work, focus on the pterygoids. Now we want to do on the external ones. Big old masseter through here. So naturally she's holding a little bit more tension on this right side than she is her left. So pressure here, open up as wide as you got. Good. Close. So she holds more tension here. This side doesn't move as much as it needs to. So the left side moves a lot more, and this is the side she's getting some clicking and clunking on. So go ahead. Good. Close. Go ahead. Let's do one more of those. Open up wide. Good. I lied. One more. Good. Keep going. Beautiful. So just lightly rest your mouth open. So pressure right through here. Pressure, then a push, okay? So there's the pressure, there's the push. Good. A little bit right here. Let your head roll. Good. Same thing right there. Good. How was it, Elizabeth?
It was
10 out of
good.
10.
Sure.
Good. So we've been working with Elizabeth for what, 2 weeks now on this?
Yes. I
Ish,
think
2-ish
this is
weeks. Week 3. Started week 3. So of course, naturally it's slow progress. We use our jaw a lot, and especially with sleeping, she's gonna be clenching, and she can't really consciously tell herself to stop clenching at night. So that's you know, kind of 2 steps forward, 1 step back. But eventually we're gonna get her to where she feels normal again.
Yeah.
So, if you guys have any questions about TMJD or anything in regards to what's going on, what we do for it, leave it down below in the comments, and we'll be more than happy to answer. Thanks for watching.
Now we're going to adjust Kaylee's neck, because that's the main source of this pain in and around her head and shoulders.
Whoa!
Breathe in. Good.
Whoa!
Do another breath. All the way out. Better. There you go. Good. Oh, you're making this easy. Let that hip drop.
Freebies only.
Good.
See?
Nice.
Freebies only.
All right. Pressure here. Let it roll.
Mm.
Same thing.
Deep breath in, all the way out. Good. Good. Just like that. All the way out. Nice and loose. Yep. Good. And then same thing on the other side there for me. All the way out. Good. Right through there. Yep. Good.
Okay.
Doing the knee adjustment right through here.
Ooh.
So a lot of pressure.
Okay.
It's just going to be a little bit of snap. Good. And then one more right through here. Good. Good. Right through there. Yep.
Oh.
Good. And same thing through the other side for me. There it was already. Yep. Good.
Oh.
Good. Good. Good.
Wow. Wow. I hope these microphones got that.
Her elbow, shoulder, first rib, all the way up the chain, because all that stuff gets tight on her. I'm barely going on her fingers on that one. Yeah, I'm excited. I'm gonna lose this and this. It's really quick. Let it go. Ooh. Now rest your head here. Just an easy stretch here. You're doing pretty good. And relax here. Good.
And out.
And again, deep breath.
Come back this way. Good. Good.
Relax the neck. Good. Alright, now wiggle your right big toe.
Nice, man. Dude, nice. Was. Loose. Let that fall.
I think the hardest thing when I tried, at least just using the stick, was the cradle. Nice. And then this is his favorite side right here. Loose, loose.
Little pressure here. Good. Thin. All the way. Good. Good. Excuse me. Good.
Ugh.
Drop that. Good. So. All right, Maddie, deep breath in, all the way out, nice and loose. Yep. Good. Oh, yeah, deep breath. And out. Oh, baby. Come back this way. Oh, there you go. Other side. Nice. Ooh. Breathe in. Ooh. Found him. Drop. Okay, roll.
Big breath. Easy exhale. Look past your right shoulder for me.
Very nice. Right shoulder. Your right hand and turn it upside down. Beautiful.
That was awesome. Oh, that felt good.
Good. And out.
Oh.
Good job.
Oh, good. Pump emo bands. Right there. So we're gonna feel a little pressure. And big breath in. Easy exhale, let this roll. Beautiful. And then loose. There we go. Nice and easy.
Now relax that side of your body. Perfect. Little push here. Good.
Loose. Good. Good. Slide your back forward. We're feeling as good as possible. And then ever so often we're trying to convince her not to ride 100 miles in a week, but
A week?
a lot.
Yeah, it's a little more than that, but we won't talk about that.
Take a deep breath in. And let it all settle. Take those fingers, interlace them for me, and keep them interlaced. There you go. Now you can drop down. Loose, loose, loose. Good. I got you. Loose, let it fall. And rest. Good, yeah. Good. Good for you. This is where you're a little tight, okay? Relax your jaw. Good.
Pressure through here first, right?
Okay.
Big breath. All the way out. One more breath in for me. All the way. A little bit more.
Yes.
Good. Let it out. Let that hit while I got you.
Yes.
Good. On your back.
As good as I can with figuring out what's going on. My patients help me out tremendously. Loose. There we go.
Right
Back
there, Dr.
Yeah,
Joppa,
I
yeah.
don't know. I can feel it right there. There's the biggest one right there.
That's so frustrating.
So you're going to take a nice deep breath in and let it relax.
Oh, wow.
Drop your shoulders.
Oh, my God.
Hello, Baltimore. It's Dr. Jeff Kalkstein with Kalkstein Chiropractic Office, your Baltimore area chiropractor. And I'm with Maddie today. Maddie, how long have you been working with us?
Oh, almost 2 years now.
2 years.
Yep.
And you're a student right now at TU?
Yep.
Yeah. What's your degree in? I tease her
Criminal
about this all the time.
justice.
Criminal justice, yeah. You know.
It was nursing when I first got hired here, and then I switched paths.
So we have a way of guiding people into their true profession, and a lot of times it turns out to be they go to chiropractic school. But Maddie wants to. But you wouldn't become a lawyer, don't you?
Yeah, I want to go to law
Eventually, right?
school.
Yeah, that's awesome. That's all right. You can help a lot of people that way too, right?
Absolutely.
Yeah.
Maybe I'll work with you.
There you go.
PI cases.
There you go. Yeah, we take care of those also. So let me ask you, what brings you into the treatment room today? What's bothering you?
My thoracic spine.
Your thoracic spine. That's her mid-back, for those of you who don't know. Go ahead and turn around. Neck, mid-back, low back, SI joints. So this is her thoracic spine. How long has it been bothering you for, Maddie?
Easily going on to 3 weeks now.
3 weeks, yeah.
With no relief.
And do you remember how it started?
I woke up one morning.
Yeah, so sometimes I call that, I don't write, I woke up with it, I write down insidious. You're really not sure what happened.
No, I'm not, but I will also say that I was working the front desk and I just wasn't focused on my posture. So I think that could have been a cause as well.
Because you don't always work at the front desk.
No.
You wear...
Running around usually.
You wear, you're cross-trained, you wear the hat that's in the back taking care of patients,
Yes.
sometimes up front too. So, okay, all right. So we kind of, before I got in here, we were sort of talking about this a little bit. It's not pain so much, but it's more discomfort.
Discomfort, tightness, just, feels
Is it
bad.
there every day
Yes.
lately? Is it getting worse?
No, I would say it's staying the same, but it's not getting better.
Okay. And the least amount of discomfort you have during the day and the most amount you have during the day on a scale of 0 to 10, 0 no, 10 you're...
2 least, 6 most.
Yeah. What is it right now after working
Yes,
all day?
yes.
Yeah. Is it more towards that 5, 6 range?
Yeah.
Okay. What makes it worse?
This motion.
Going into thoracic
Yes,
extension?
extension.
Yeah, what else?
Deflection. Or just like going back to my normal posture.
Okay. Standing long periods of time make it worse?
Standing? No.
No?
I would say sitting.
When you wake up in the morning?
Yes.
Okay, all right. And you're out of school right now. Were you doing a mini-mester or anything like that?
No.
No, okay. So how many hours a week do you think you're
A week?
reading, studying?
No, none right now, honestly.
Papers?
No.
Exams? Oh, that's all over
It's
with?
all over with,
Okay,
yeah.
all right.
It's just
What makes it
work
feel better?
And hot showers help
showers.
compared to a heating pad.
Okay.
So moist heat, rolling it out with a lacrosse ball against the wall,
Yeah.
and
Do you learn
just
some of those tricks here?
massages.
So you haven't been adjusted for, the middle of December, maybe one more time after that?
Mm-hmm.
What was within the last 2 weeks maybe, or no?
Yes.
Okay. Anything else bother you?
No, I mean the really only thing that is killing me is I'll go to stretch because
Like
it
that.
really feels like I need a stretch, and then
do you
I
feel like
return.
you get to the point where you feel it blocked or restricted?
Like I can't go anymore. Like that's
Yeah.
my range of motion.
And that's uncomfortable like that.
Mm-hmm.
Yeah. Okay. Face me this way. Let's have you just turn your head to the left as far as you can go. Good. Any discomfort? Go this way for me. Any discomfort? Yep. With your mouth closed, bring your chin down to your chest all the way. Any discomfort there? I'm going to put a little light pressure here. You tell me if that's uncomfortable anywhere, okay? How about that? Does that bother you?
Maybe
A little bit right
C7.
there? Yep, okay. Ben, look up at the sky. Any discomfort there? Yeah, where? Same spot?
C7, T1.
But not down in that mid-back region?
No.
Yeah, so go back again.
I don't think so.
So if I load that a little bit and I'm going to go light, does that increase it? Uh-huh. Yeah, so come over this way.
Yes.
Does that increase it? Uh-huh. What side's that on? That side. And then come over here this way. Does that bother it? Mm-hmm. What side?
side.
That side, yeah. So those are, so we do all these tests and range of motion, things like that. We're really trying to find out what's generating the discomfort. Is the discomfort from a disc injury possibly, or is it coming from a joint, or that joint sometimes is called a facet joint through most of the body? There are 2 joints in the body, Maddie, facet joints, one on each side, and then down in your pelvis there's the sacroiliac joint, right?
Yes.
So, so stand up nice and tall, arms to your side, tilt this way. Does that bother you at all?
Stretch.
Yeah. And then the third thing that we sometimes is a pain generator, it's soft tissue, muscle, fascial pain. Does that bother you at all?
Yeah.
What side?
Here.
Yeah, so more so on that side.
I guess so.
Yeah. So take your arm and just lift it over your head like that for me. No problem there, right?
No.
Same thing, yeah. Now, one at a time, palm out towards me, lift it over your head that way, all the way up. No problem, right? Yeah, she's got really great, I'm jealous. I wish I could move I wish my range of motion was that complete like yours. Does that bother you at all? No. Go this way. Does that bother you at all?
No.
No. Go straight back. Does that bother anything?
No.
No, not your thoracic spine right now? No, good. So this, so I'm looking at her neck and her low back right now. None
Low
of those
back.
bother? No problem, right?
Low back.
Which side? Going that way?
Midline.
Midline, okay. Let's have you, I
Bilateral.
want you to lie on your tummy for me. And so we probably should take that off.
Also, fun fact, guys, this is Dr. Jeff's first time adjusting me.
Does that mean you're going to chiropractic school? Because sometimes that's what happens. And you go ahead and lean in. And let me have your arms up to the pads. Yep. You haven't had any falls or anything, have you?
No.
No. And slide up a little bit right there is good. Okay. And I'm going to do one more thing when we're done. I want to check your ability to bend forward too. So, and we're just going to do a little palpation. And what I'm looking for is I'm looking for restriction in this glide from back to front that I'm going through. I'm taking my fingertips and walking up every level. See, like right there, Maddie. That one doesn't want to move as freely as the other ones, okay? So to me, that's a restricted area or an area that's locked up. Technically, we would call that a hypomobile segment. There's another one right there. Yeah, you got a couple
Right
back
there, Dr.
Yeah,
Jeff,
I
yeah.
don't know. I can feel it right there. There's the biggest one right there.
That's so frustrating.
Yeah, I got it. Now, so we'll just play a game here a little bit. If I put some pressure between your spinous processes, is that painful right there?
Yes.
Yes. How about this one? Which one more?
one.
This one here or this one?
I think the lower one.
This one right here.
Yeah.
Yeah. Now, how about this one compared to the one above? The kind of the same?
Both, yeah, equal.
So what happens is there are nerve endings that go to the facet joint. The name of that nerve is the medial branch of the dorsal rami. So when the facet joints, those are the hinges that allow motion to occur, become restricted and congested. They irritate that nerve, and that nerve also goes to this area right between the interspinous space. So that just kind of confirms that we've got an area that functionally isn't moving the way it should, right? And so, and the way we get that, is that the spot right in there?
Yeah, and the one you just pressed before that.
Yeah. So the way we address that is we're going to adjust that, right? Now, I know you've been adjusted by some of the docs in the office. Do they adjust you with your face down and push down, or do they take you over to the table back there and adjust you with your hands over your head?
I've been adjusted both ways, but typically face down.
Which one do you find to be the most effective?
Probably face down.
Face down. Okay. All right.
So you think it's a nerve, is what you're saying?
No, I think is, again, we talk about pain generation. I think it primarily is you have those hinges, and just so happens we have a halfway decent looking spine in here, and I'll show you. So we'll zero in on this, and again, this is a low back vertebrae. Okay, it's larger than your thoracic vertebrae, but the anatomy is pretty much the same. The vertebral body, between each vertebral body or bone is a disc. And the disc has two parts to it. It has the outer fibers and the nucleus pulposus in the middle. This is the jelly-like structure, and this is the connective tissue, if you will, okay? So if those fibers become irritated or deranged, it makes them weaker, and this stuff is under a lot of pressure. It starts to push those out. If that's allowed to continue, you can have back pain because there are nerve fibers that go into the outer half of the disc. So if those fibers tear, you can have back pain. But really, a lot of times they start to tear from the inside and they work out. And there's a lot of stress there, but there's no pain. But finally, it crosses that threshold, and all of a sudden you're going, oh, I got back pain again. So that's one region you could have pain. It comes from the disc. The second would be in the back part of the spine, where the structure from above and the structure from below articulate or join. That's the hinge, just like the hinge in my finger, the joint in my finger. I say hinge, it's a joint, okay? If I took cellophane and wrapped it around there a bunch of times, that would represent the ligament. And the purpose of that ligament is to allow the joint to move just so much, not too much, right? Just the right amount, all right? And then they created an opening down through the spine this way, and they created an opening on each side of the spine. That's your spinal cord, that's your nerve root. Off of that main nerve gives a fiber, like a telephone wire to your house, like in the old days, and that nerve that goes to that hinge is called the medial branch of the dorsal rami. It's sensory. What's unique about that, there are small muscles that attach from your transverse process, that's this bone right here, to your spinous process, and that muscle is called the multifidi. So what happens is the medial branch nerve gets irritated, sends signals to your brain, the brain says, I don't like this. It's in response sends signals down to that multifidi muscle, and it creates this stuck or fixated segment, right? So that we call that dysfunction in our office, right? So really it's like Goldilocks. If you look over here, this is supple movement, just like that. So when I'm pressing on your mid-back, I'm right in the middle, I'm right on these segments right here, and I'm walking down with my finger on each side of that spinous process, and I'm just pushing in. Here's what I want to see. I want to feel this. Supple, right? What I don't want to feel, and this is an exaggeration a little bit, I don't want to feel like this is blocked or like that. So at your age, it's still pretty supple, but I can still find it. It's very obvious to me. Now, if I was on that table, right, at my age, I would be more like this, right? So I'm a heck of a lot more of a challenge for the most part than you, right? So you'd have to take me apart and have a different strategy for someone like me than you. So, and then the other extreme, so it's Goldilocks again, just right, too cold. On that side, that's hypo, fixated, locked up, does not move right. Over there is either a car accident or a sports injury where we've actually, remember I said we had cellophane around there? We've actually had so much force delivered to that segment that it tears that soft tissue. And if it tears it enough, that protective mechanism is gone, and guess what? It becomes not hypo, it becomes hyper. The people who are on this side of Goldilocks, really with the right treatment respond very well. These folks over here, that's a different story. That's a different kind of challenge, right? So with these people, we try to stabilize the supporting tissue above and below that area so it can heal as best it can, right? So that's a long story short. I know you just want to get adjusted.
No, I like it. I like it.
So let's do this though. Have you had an adjustment with your hands over your head lately?
Yes.
And who gave? And was it a good experience or not a good experience?
Fine experience.
Let's start with that, okay? Let's go do that with the hands over your head down the hallway, okay? So Maddie, stand right here for me. There's one thing I want to check that I didn't do in your low back range of motion. Let me see you put a couple inches between your ankles. Yep, then less than that, about half. So from this position, what I want you to do is I want you to just bend down and touch your toes, drop your head all the way down. Yeah, good. Okay. Okay. Come on back up for me. So one more time, bend down again for me, all the way down. And I'm going to just lower this down a little bit up here so I can see what I want to see. I'm just looking to see if she has a little bit of thoracic curvature, and she might have it just
I do.
tiny bit up there, yeah. And I'm going to do one more thing. Back on the table for me, Maddie. And lie on your back for me. On your back. Your other back.
Dr. Jeff.
What?
Is that scoliosis?
We don't know. We'll have to take a closer look.
We love Dr. Jeff here at Kalkstein Chiropractic. He is the bomb.
All right, now rest your hands on your belly button. So if I press, let's start over on this side. Is that uncomfortable at all? Yeah, compare this side.
Yeah. Oh, which one
yes,
more?
yeah, which one more? About the same?
That one.
This one over here? Okay.
Yeah, that's actually really uncomfortable.
Yeah, okay, all right. So let's go out and do the thoracic adjustment with your hands over your head.
Sure.
Okay? And then we'll come back and adjust that first rib and your neck a little bit. Okay? So we usually don't do this in the room because the table's a lot more comfortable for the patient. So scoot forward just a tiny bit, yeah, right? And so what you're going to do is you're going to put your hands on top of your head. You're going to interlace your fingers, and they're going to be relaxed. They're going to stay like that for me. Okay? And you're going to drop your arms forward. You're going to drop your chin to your chest. And just keep your arms like that and come on back against my thigh. Yep, that's perfect right there. Now, so from this position, open your elbows, but keep your hands there. Okay? And have you been adjusted like this before or no?
Like once.
One time, okay. So you're going to take a nice deep breath in and let it relax.
Oh, wow.
Okay, good. That was perfect. Very good. Now swing your legs off.
That was good.
Okay, now let's go back to the room, okay? And let's go now face down for me. So, I think anybody who spends a lot of time working at their desk, that adjustment is amazing. That just frees all that locked up mid-back, because everybody's with their head down working or they're on their phone. Those kind of problems really resolve nicely getting that function restored or that motion restored to that mid-back, okay? That right there's good. Now let your arms loose. Let them hang down to the carpet. I'm going to take that away because... Again, just relax for me. Yeah. Take another deep breath in. Let it go. Relax. Lift your head up for me a little bit. That was beautiful. Really nice job. That was good, yeah. So some of that becomes it distracts you, but it also allows me to get in there and sneak in there and get there like that. That was nice. That wasn't uncomfortable at all, was it?
No.
Didn't hurt at all.
No.
Either one of them, right?
That was just like a marshmallow.
Yeah, on your back for me. And I'm going to adjust your neck. And in order for me to adjust your first rib, we're going to have to take our mics off. We might do that off camera. We don't give all our secrets away.
Yeah. Ooh, wow.
Yeah, just relax for me.
Okay.
Yeah, just relax. Yeah, I know what we're going to do next. It's the same idea that I was doing before with your mid-back. I'm trying to find out where there isn't a lot of motion. Is that a little uncomfortable right there?
Oh, yeah.
Yeah, and compare that side.
Fine.
Yeah, but this side right there, isn't it? Yeah. Okay, so this is probably one of my favorite adjustments. It's called an occipital lift. Have you had one of those before? Yeah. Okay, now relax. Okay, now drop your shoulders.
Oh my God. That's legit.
That's legit.
Wow.
That's the real McCoy.
Yeah.
So go ahead and stand up for me.
Okay.
I don't think we needed your mic. I think they probably heard it on the other side of Towson.
It's Dr. Jeff.
But what's really important is this. It's not the sound. It's
No.
getting the right segment, the right area to move. I'm going to check. Go ahead, lie on your
Okay.
back for me.
I'm proud of you for that one.
Yeah, you can just edit that stuff out. Relax. No, just right here. Just relax. See, that's supple now. So basically, this top cervical vertebrae and the skull sit on each other like this. And when I was palpating to see if there was motion, there was no motion on this side, or very little motion on this side between C0 and her occiput, right? And that occipital lift is it's such a wonderful technique for people who have headaches or neck pain. Was that comfortable too?
Yeah.
It sounded loud, but it was comfortable, right?
Yeah, absolutely.
Yeah. Okay.
No pain.
Okay, so now, that's part of it. But I think also, and we can do this the next time, I think we need to show you how to foam roll your mid-back. And you were doing some with a ball, which is very effective. But I think we also need to do some some exercises.
Yes.
To function, to work on the rhomboids between your shoulder blades. And we'll show you that on the next visit. And this may be part of the gold standard for someone who has, I think they call it like, it's tech neck, but tech neck is an upper back, or they kind of roll in there together, or upper cross syndrome. And so you want to get the joints to move. You want the soft tissue adhesions to free up, and we do dry needling for that. We do shock wave for that. We foam roll for that. We do some soft tissue release for that.
Yes.
But then we want to start to get some stability in there, and we're going to do that through some corrective exercises.
Yes, please.
Okay?
Okay.
Yeah, so
Yeah.
this is good for right now, okay?
All the way out. All right, a little pressure here on the left first. Let it roll, little pull. Good morning, everybody. It's Dr. Nick here at Kalkstein Chiropractic, your Baltimore area chiropractor. We're here with our lovely office manager, Tanya. And Tanya, like most people, is starting to get some seasonal allergies. Pollen, primarily. We're in March now, so things are starting to bloom. It's like 75 today, which is insane.
Awesome.
So, for her, she's suffering quite a bit in the nasal department. So what we're gonna do, we're gonna help kind of get some things flushed out, get her moving a little bit easier, and hopefully feeling better today. So Tanya, let me get you on your stomach first here.
Okay.
All the way in. The worst thing about allergies, for me at least, is the fact that the sinuses get inflamed. I don't have a lot of snot, I guess, but it's like a faucet that's never ending. So like it just runs. And when you blow, nothing comes out, which is the most annoying part. So what I find pretty common amongst people with seasonal allergies that are blowing their nose a lot, coughing, sneezing, all that sort of jazz, is their T-spine is going to be real locked up. And for Tanya, she is, especially right through there. You made that easy for me. All right, take a breath in. All the way out. A little bit more up top here. I want you to breathe in. As you let out, let those shoulders sink with you into the table. Good, all the way. There it is. Good. Okay. I'm gonna bring you up and flip you over.
Okay.
Onto your back. So what we can do for you. What can we do for you here? Tanya, can you answer that? I can. The adjustment's gonna be a biggie. But more importantly, a little sinus massage, for a lack of better verbiage. So you have really two sinuses that we can really affect. It's gonna be your frontal up top here and your maxillary kind of down by the corners of your nose. That's why some people, when they say they have sinus headaches, like it'll be like right up here, or sinus pressure is gonna be here or right there on the cheekbones too. All right, a little pressure here on the left first. Let it roll, little pull. Good. All right, so let's work on frontals first. You can do this on yourself at home too. Makes it pretty easy. What you're gonna do is you're gonna feel just right, kind of where your brows meet the bridge of your nose. There's gonna be a little indentation there. We call that a foramina or a foramen.
and your supraorbital nerve exits there. And that nerve is a distal branch of cranial nerve 1 that also innervates your frontal sinus. So if we can create some sort of stimulation on the supraorbital nerve here, we can affect the frontal sinus. Yay! So what I'm doing right now is just a little acupressure. So putting pressure through that area and just letting it relax. You can see she's already getting really red through there. Is it tender right through there, Tanya?
Slightly, yes.
Slightly, yeah. Just kind of moving that tissue back and forth over the top of those. When I'm really flared up, just the littlest amount of pressure through here will light me up like a Christmas tree. My eyes start to water and my nose really runs afterwards. Maxillary is a little trickier to find. You just kind of have to probe around until you find the area that's going to be the most tender. Okay, so right through there. And you can do a little bit of a cross friction massage through there. You okay with that pressure?
Mm-hmm.
You're gonna have some nice rosy cheeks afterwards. Tender through there?
It is.
Yeah. Good. Alrighty, Tanya. You're cured. Just kidding. This will be a work in progress, especially through these starting months when everything's really starting to bloom and kind of pollinate. Be the best time to get in here. All right, guys, so in regards to what we just did with Tanya in the room with the manipulation and the soft tissue work, I would also start to incorporate some dry needling and some laser therapy over these sinuses. Both of these modalities are very good at helping getting the drainage really flowing, kind of getting that stuff loosened up and out of the sinus cavities there. A little bit more aggressive approach, but we've had some really good results with, is our shockwave. So we've been using a very soft tip on our shockwave device and focusing over these sinuses of your face, you know, your frontal and your maxillary. And that seems to be doing a very potent job at getting everything kind of flushed out and moving as well. Sound good?
Yeah,
Cool.
thank you so much.
So today's Thursday. Let's see you tomorrow, Tanya.
All right,
We'll see you
sounds
tomorrow.
good.
Guys, if you have any questions about kind of what we can do for you here, if you want to get treatment yourself, check us out at towsonchiro.com. Otherwise, leave some comments down below. Be more than happy to answer them. We'll see you in the next one.
So this is how you get a cervicothoracic junction to the end range of the actual joint. You good with that?
Oh yeah,
Okay.
that's great.
So just really fall into my hands. Keep your teeth together gently. Nice. Nice.
Never got that one before. That was good.
That's a new one. What's up, everybody? Dr. Alec here. I'm with Mike today, a fan favorite, as the comments would point out. So that's really why we're doing this. Mike, is there anything going on with you today that you want me to pay particular attention to?
You know, just some overall neck soreness,
Okay.
a little bit of back stiffness. Nothing out of the ordinary from just working out.
When you say back, do you mean mid-back or low-back?
A little bit of both. Most
Okay.
of my tension is kind of carried right in the mid back, really.
understood. And when you say neck, do you mean where your head is meeting your neck or where your neck is meeting your mid-back? Lower neck, upper neck?
I would say the lower neck. Kind of right in the trap shoulder area.
You got it. Let me get you face down. Let me take a look at this. Oh yeah, see what's going on with Mike. You know, me and Mike go to the same gym, but we have yet to cross paths, which is really sad.
We have quite the opposite schedules.
When do you go, Mike?
Late at night.
Okay, well,
Usually 8 or 9 p.m.
Yeah, you won't catch me there then. I'm all out of gas. Shout out to Exile Gym in Rosedale, Maryland. Wow.
A lot of cracks.
You're crunchy, and I'm not even trying to send it yet. Okay, so TL junction, really sticky on Mike. I mean, there's predictable places that even if you're not dealing with, some exacerbated pain syndrome, there are some pretty predictable places where you're going to feel pain. If you're getting after it the way Mike is, your TL junction is going to be locked up. You're probably going to hold it through the mid-back. CT junction like he's describing. So, yeah, I can feel his right CT junction. Left a little bit, but it's more so on his right. A little cranky. So I'm going to hit his TL, and this has to be light. And this is for the students out there. If you're hitting a TL junction prone, especially with the thoracic piece opened up, you do not want to give that too much sauce, or else you're going to have people sweating bullets and running out the front door pretty much instantaneously. So let me get a deep breath out of you, Mike. And it's just a click. Like, you know you got the TL when it is a click. And if someone's hot, I would never hit it prone. So what I'm gonna do to get his CT junction, because I think the rest of his mid-back is pretty good. Mike, are you capable of looking to your left? Nice, dude. And just relax your head. Is that a painful position for you to be in?
Not at all.
Okay, I love that. So this is how you get a cervicothoracic junction to the end range of the actual joint. You good with that?
Oh yeah,
Okay.
that's great.
That blew up. That wasn't a big audible, but that thing moved. Mike, let me get you on your side, bud.
Facing you?
Yes, please. I'd appreciate it. So I'm gonna get you here. I'm gonna get you here. Just while I have Mike in this position, this is another place I can show. See, you feel that little click?
Yeah.
Literally, just rolling him over. I kind of got his TL again. I feel just a little bit of tightness. Way down low.
Oh yeah, that was a good one.
Are you relatively pain-free when you squat and dead and things like that?
Yeah, usually pain-free. It's more just,
Me too,
after
so.
hours of standing that I'll feel anything.
Okay. And you're you're clean from a discogenic standpoint. You don't have any pain when you sit for long periods of time? Okay.
Nope.
You know what that's a product of? Is proper lifting mechanics.
I appreciate it, Dr. Allen.
I salute you. This is a little stiffer on this side. That's probably a little less comfortable.
A little bit.
Yeah. Let's see what's going on with these hips.
The hips don't lie, as they say.
Hip though. What do I get? Yeah, I did that left hip. Okay. Okay. I'm not gonna give you that one. So I know you're talking about stiffness in your lower neck. A little bit of it's there. Your upper neck, a little cranky too. So the way that I'm gonna seal the deal here. It's actually in the chair. Mike's gonna get an O lift today. Hey, just you make yourself comfy, buddy.
All right.
I'm gonna fix this. Yeah. So his occiput on the left side, a little dysfunctional. So just really fall into my hands. Keep your teeth together gently. Nice. Nice.
Never got that one before. That was good.
That's a new one. You okay with that?
Oh yeah, that was good.
You just let me check my work real quick. Yeah, see, something that didn't seem dysfunctional before, once you adjust the one side, it can, there it was. So that was a pretty pure occiput, right? That was no other joint, but right where C0 meets C1. A little bit on the CT. There. Okay? So, you okay? You cool with all that?
Oh yeah.
Well, guys, that was a full body adjustment of Mike. I hope you enjoy. Don't forget to subscribe. Any questions or comments, leave them below. Thank you so much. See you next time.
What's the difference between dry needle and acupuncture? You were thinking maybe? Or I get asked like every time we do a dry needling video. Same tool, very similar. Different lengths of the same tool. What we're using right now, you're seeing a 1-inch dry needle. Really skinny, small needle. It's pushing, it's not cutting through tissue. It's a stimulus I'm trying to create locally. I'm trying to stir in a little bit of an inflammatory response locally so that the body brings all those good things that come when we're injured.
And then remind me, were you fearful of needles?
Certainly was. Definitely a little fearful of needles, but the relief that I get is worth it.
And that's kind of common with some patients that, like, yes, needles, when they hear needles, they're like, oh my gosh, a syringe type needle.
Yes.
Any needle, to be fair, is going to be a little uncomfortable.
Right.
But just like Sam said, the benefits outweighs just a little, temporary pain or prick.
Yep.
And
I feel like I'm at a point where most of the time it just feels like pressure in a way, not necessarily that, but there's definitely ones you said that maybe are a little more sticky that might need it.
That's a really good point, that this should turn into just like a weird pressure. But the spicy ones that we do find, the next needles, your body kind of anticipates that same reaction. So that's why you can kind of be a little jumpy sometimes. So now we're gonna get her traps.
These are my spicy ones. Whew.
Definitely feels looser, not as tight putting the needles in.
I was gonna say, I remember feeling like a lot more pressure or a lot more like of that spiciness before, but I'm not feeling as much as that now.
That's good. Like your body's getting a little desensitized to the needles.
Like a little bit looser.
Exactly.
It's kind of amazing to, gauge progress that way, like how the needles feel.
Yeah.
While they're going in, not necessarily after, but.
I'm sorry, I'm not trying to pick this up.
Beautiful. So now I'm gonna get her T-spine.
Ooh, yeah, right there.
So always gonna palpate
Right,
landmarks. marks.
Right.
Inferior border of her scap. Line. And we're gonna go towards the spine with the needles, and there's a lot of sensitive structures potentially underneath there. Lungs is the most common.
Right.
Don't want to give you a Nemo.
Oh no, that'd not be great. Crazy, I like really feel it in that area of my back. Like when you press on it with your fingers, it's like, again, they're taking my breath away.
Which is why we're gonna start learning a few exercises that you'll become a little bit stronger. And
I love that. Always want to be stronger.
Yes.
I'm gonna get started all the way up here and then work my way down distally to that knee. A lot of people ask if dry needling hurts. What do you think, Maddie?
No, I was just going to say it doesn't really hurt, but I will say it kind of makes you tense and nervous because the anticipation for them. But once...
Yeah, so that's what we're going after right there.
But when it's in a sweet spot, it's a little tender. It's not a true pain.
Yeah. And that pain, if it is pain...
We remove it, or...
Well, we give it a few seconds for it to relax.
Yeah, but
There's
if it's
another one.
unbearable...
Hopefully the camera caught that muscle twitch right there. Yep.
You can feel like heavy, like the dry needle. You can feel like
Heavy?
weight.
All right, then last one right through there. You're a trooper.
No way.
Good. Awesome.
Cool. Thank you, Dr. Brady.
Absolutely.
Yay.
Like looks very Scranton. Northeastern PA.
Okay.
Poconos.
Oh, nice. It's the one area I haven't been yet that I would like to try.
It's pretty not much there.
Taurus-wise, maybe a little bit.
They're skiing.
And Poconos?
Mm-hmm.
Did not know that. Where's Seven Springs emulation?
Seven Springs is in Pittsburgh.
Pittsburgh?
Yeah.
Oh.
I think so.
I knew it was in PA.
I think it's in Pittsburgh.
Okay.
Like Jack Frost's Big Boulder.
Oh, yeah.
Near in the Poconos. Lakes, cabin things, woods, rivers. There's whitewater rafting.
How do you say creek?
I say creek, but the locals do say creek.
Creek, right? I used to live in like Deep Creek area.
Oh, gotcha.
And a lot of people that I've met too would say that.
Deep.
And I was like, where does that come from? Like, say creek for me. And they can say it, they just I guess choose to say
Yeah,
creek.
I think yes, they just do it on purpose.
Alrighty. How are these?
Good.
So I want to focus kind of with the needles here is hit the big muscles of her low back, her lumbar. Get her erectors, multifidi, and she also has a lot of kind of QL tension and pain. So we'll show that area some love too. How you feeling with these so far? Sweating?
Yeah.
Good.
Pretty much.
Good. Don't be holding your breath. Nice and slow.
Holding the breath's the only way.
No, it's not. Don't do that.
Oh
That was a good one. I
yeah.
felt that.
It like jumped.
Good. You're doing great. There you go.
Aubrey.
Lots of Lucy's. Yeah, I accidentally threw away a box thinking that we had enough to fit them. We did not. So we will use them for you. Yeah.
Give me. You cool with 3 more?
Yeah, go for it.
Okay.
Go for it.
Yup. Last one.
I'm dying.
That will do it.
That'll do.
You cool with those?
Yep.
Alright, you're cooking here for 10 minutes. Just think how great the laser's gonna feel after this.
One's a black one with Kalkstein and one's a blue.
Thank you.
You're so welcome.
Yeah, I know.
Whoa, okay.
Last one right here, okay?
I just didn't want them, like, anyone to be like, what the hell?
Might be a little pinchy.
It is a small pinch, but nothing bad.
Good.
That's the one.
Is it now? Oh yeah.
That one too. It's like your average needle.
Right, and that's what my parents did. They were like, because I was in Towson.
Average needle. Ooh, that was a good one.
That
You know
was.
what I wanted to say? I was like, my brother ended up going out of state. And they spent like a way more on him. And I was like, can you add up the difference between our Can I have that?
What are you going to do today?
So, yeah, I only took out the low social worker. And my job for my gas, my house, or my apartment, my house.
So relative to some of the tissue work that we're going to do here, this is the result of a problem. This is where the pain is. So I am definitely going to treat locally here because this is where he's hurting. But my goal and my focus is more lower extremity and core as it relates to what I want to try to change over the course of time. So I'm going to work this area. He's doing a lot better. Like he said, he's feeling a lot better. He's moving better too in this area. Sorry, it's sensitive in the foot, but you know, just kind of a couple moments of a little discomfort, and then it's really worth it, especially when you're dealing with chronic heel and calf pain. It's the worst, especially at the end of the day. Plantar fasciitis, stiff in the morning, gets better and then gets worse, is usually kind of the roll that it goes through. Feels like, you said that's exactly what happens? Yeah. Pressure. Good. Hey, Carly, let me help you out. There you go.
Just go head down like this. Hang on 1 second before you get down on that though.
What's the difference between dry needle and acupuncture? You were thinking maybe? Or I get asked like every time we do a dry needling video. Same tool, very similar. Different lengths of the same tool. What we're using right now, you're seeing a 1-inch dry needle. Really skinny, small needle. It's pushing, it's not cutting through tissue. It's a stimulus I'm trying to create locally. I'm trying to stir in a little bit of an inflammatory response locally so that the body brings all those good things that come when we're injured. So I'm hijacking the body systems, if you will, that way. There's a mechanical release of tension locally to fascia and a stimulus to the nervous system to also release tension in trigger points or in tissues themselves. Blood flow is like kind of a loose term a lot of people use when they're treating an injury. There's a lot of physiological changes happening locally here as well as in the cortex that help with pain. But acupuncture is going to be a little bit more just different language, different textbook, if you will, to what happens in the body. So they use energy or chi, they use lines and meridians, they're stimulating or not stimulating a tissue or an energy. There is, think like this is muscle, joint, local problem. Acupuncture be treating like asthma or different systems in the body, and there's different elements along those chains of energy, and they're trying to stimulate it. There's a lot of correlations between different lines, so it's a totally different approach. It's a type of medicine in its own right, if you will, traditional Chinese medicine. And now I'm treating his gastroc. There's two major heads there that I'm going up, and this lateral belly is definitely hanging out with a little bit more tension in here. You might feel a little jump here, buddy. Good. How you doing up there, Zach?
I'm alive. Try not to flinch.
You doing pretty good. No flinching over here.
Oh no.
We are impressed.
Thank you.
So you can kind of visualize that.
Yeah.
A joint restriction in the CT junction here, cervico-thoracic junction. So I'm going to be doing some dry needling in that region, and then particularly where he's getting his pain and where he's noticing it the most is in his mid-thoracic spine, where he's got joint and rib dysfunction here. He feels muscle stiffness through here. On his exam, he had just some joint restriction as well as some trigger points in the areas that I've needled so far. And then you can kind of feel this tension right here that I'm rolling over, which is some erector spinae fibers that are tight and hypertonic. And I'm going to be dry needling.
It feels like a tightening, and then it goes away.
Yep. And underneath my fingertips, I can feel that muscle.
Yeah, right now.
Right there. Yeah, there it is, right there. Let's see if see if you can see that bounce at all. Sometimes, yeah. So a lot of times, physical therapists or even chiropractors, well, there it is, right there. It's jumping right now. So that's like a pistoning effect. I prefer personally and clinically. I like finding the trigger point, setting the needle in, and then just letting it sit there rather than go after it like that.
Yeah.
But some clients like the trigger point, okay? All right, last one is your levator scap, okay?
I was gonna ask, did you wanna, I was like, it feels like the pain is a little more lower as well.
Sure.
So I don't know if
on this side?
Yeah,
Yeah.
it goes really far down.
Yeah, I'll be happy to continue that. So I would say, even though it's your thoracic spine, we just get this upper trap involvement, levator scap involvement.
Yeah. Well, especially because that's my normal problem. That makes sense.
Yeah, no, I'll be happy to go down.
It's so painful. I don't know what I did.
Yeah.
Yeah, like all up under there. Ooh.
Yeah. So we'll get into the lower rhomboids. So I get the needle almost horizontal to the curvature of her back, and then I'm just going to gather the tissue in, and I'm going to slide the needle in. There we go. I'm going to run out of needles on you. We use different size needles depending on the depth of the tissue, okay? So we're going to let these, were you adjusted earlier today also?
Yeah.
Yeah. And so with Miss Davis, what we did, we didn't do the trigger point dye needling. We adjusted her in a certain way.
Yeah.
Had you seen, I know you've seen it here, had you seen that adjustment anywhere else?
I've never seen, no, not until I got here.
Yeah.
So Dr. Warren did that on me, and then did some prone adjusting.
Yep.
And then he did some, I think it was some ART as well.
And there's a big difference here. I think Miss Davis was definitely a rib, and that's all it was, pretty much, right?
I think mine's mostly muscle for sure.
And she felt significantly better when she left here, didn't she?
Yeah.
I mean, she couldn't even take a deep breath in. By the time she left here,
yeah,
she felt significantly better. And we because she was so acute, we put some ice and stim on it. And then Aaron actually we have a 25 watt class 4 laser, which is really a powerful modality that we use in the office.
And that line of tension within the QL.
We were thinking, with MLK, maybe some people already had.
Okay, that one wasn't bad.
Good.
Yep. I already can tell. Jeez. How come you touching it already caused stuff?
Say again?
How come you touching it already caused stuff?
Me touching it caused stuff?
Mm-hmm.
What do you mean?
Pain. Not pain. Like, I can feel it. Like,
dull achiness?
Because the pressure I was putting through it is enough just to kind of bring it to your consciousness.
Your consciousness.
You kind of focus on that.
Gross.
That's why you see all those bodybuilders. Maybe you haven't seen it.
Probably not.
But you might see it on YouTube. When people are working out, they'll have the buddy, their spotter, whoever they're working out with. They'll say they're doing chest, and the guy's on the bench press, and he's repping out some reps, and you see his buddy kind of like tap his pecs. So he's providing information for the guy lifting to really kind of focus in on the area or the muscle he's wanting to target the most.
So weird.
So just for the sheer fact of poking on it,
Oh my god.
made her consciously aware of it.
Well, Tawanda, I'll meet you on the other side and we'll get you out of here, okay?
Alright.
Yeah.
So with the erectors and the multifidi, through this area, we're using just a slightly longer needle. We're trying to get those deep spinal stabilizers, aka the multifidi, with these. So we need a little bit longer needle to reach those muscles. In most situations, we're driving all the way down to the bone.
Great.
Of course, they can't feel that.
Sure.
They can feel the pressure of the needle splitting through the muscle fibers, but they don't know we're hitting bone.
Now I do.
You do now, because I told you, but that's cheating, right?
No.
Good.
Death.
Yeah, that one's a good one.
Winner. Chicken dinner.
Give me one more.
Go till your heart desires.
Oh, don't say that. You look like a porcupine.
Yay.
That's it for the video. If you guys have any questions or comments, leave them down below. I'd be happy to answer them. I myself personally read them and answer them.
You do?
I do. It's fun. I love them. I love them. I love engaging with the people. Isn't that right? Yeah.
He's a
All right, guys. We'll
guy.
catch you in the next one.